What
Okay.
time? Okay.
Hello, this is Dr. Naurin, one of the doctor in this suburban clinic. So how may I address you today?
Yeah, you can address me, Mr. Smith.
Okay, Mr. Smith, good afternoon. Nice to meet you with you and as well as your son Matthew. So, Mr. Smith, can you please tell me more about your concern for coming today?
Yeah, doctor. As you know, my son Matthew, he had severe uh, cough and respiratory difficulties a few days ago, and cough usually more at night. And for that, uh, he was admitted
Mhm.
in the hospital emergency department, and after treatment,
Okay.
he discharged with some advice and
Mm-hmm.
some advice. And
Okay.
I'm worried about his condition. That's why I'm here, doctor.
Okay. Okay, I'm really sorry to hear it, Mr. Smith. I understand it is very hard for you. Please don't worry, I'm here to help you. So, Mr. Smith, can you please tell me how much you learn about the asthma from hospital?
Doctor, I learned just it's a respiratory problem, and here
Mm-hmm.
uh, uh, some symptoms like breathing difficulties, some
Mm-hmm.
noisy sound, and shortness of breath and severe cough can happen, and
Okay.
it needs some management as well.
Okay, that's fine. So, Mr. Smith, now I am giving some more idea about the asthma. Like it is on kind of condition in which the airway of the lungs become narrowing. And that is why patient having some symptoms like shortness of the breath, wheezing, and so on, and which your son already had. Are you with me so far?
Yeah, doctor.
Okay, so what basically you came here for follow-up visit, and which thing you want to know more from me today, from today's consultations?
Doctor, I am very much worried about Matthew's condition.
Mm-hmm.
He had asthma, severe asthma attack last few days ago, and at that time I was so much panic, and I seek advice from the hospital, but that brings me a great stressful condition, and said that's why
Yeah.
I'm here to know about how can I manage Matthew's condition in future.
Okay. That's great. I'm really appreciating your concern. So, Mr. Smith, now I'm going to give some idea about how can you control your son's conditions. Okay. So,
Uh,
first of all, you should identify the trigger factor, which make this situation more worse, or which make the initiation of the asthma. Okay. So, when you identify the trigger factor, then you should control that trigger factor. This is the first point of the management of asthma. Okay. And you should also know about the severity of the symptoms. Like in which situation, which type of medication you should give your son. When it is severe, when it is mild, when it is moderate. And not only that, you should also learn about the urgent situation as well. And as your son is when will go to the childcare or in the e-school, you should also inform the school as well about this situation. Okay, and in case of emergency situation and as well as in case of e-school, is there any severe attack happen? In that case, there is a medication which we call salbutamol, which we can give to your son to control that severe situation as well. Are you with me so far, Mr. Smith?
yeah, doctor.
Okay, that's fine. So I'm assuring you that the prognosis of this disease is very good. So don't worry about it. And if you understand the proper trigger, if you control that trigger, and if you know what exactly need to do during the acute situation, you can manage it appropriately and properly. So don't worry about it. Okay. And I am giving you some reading material regarding the asthma, and as well as I will giving you the asthma action plan. And don't worry, I will review your kit as soon as possible. And here is my contact number. If anytime you see that your baby is not going well and any alarming symptoms, in that case, come to us immediately. Thank you so much.
Thank you, doctor.
Give me the feedback.
আপু